Hello, everyone, and welcome to our Form Health webinar. If you've ever asked yourself, what is medical weight loss? Then you have come to the right place. My name is Dr. Lauren Lemieux, and I'm a physician at Form Health. I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by Bridget McCormick, a registered dietitian at Form Health, who's also a certified specialist in obesity and weight management and diabetes care and education. So for today's webinar, just a few announcements before we get started. It is being recorded, so if you're not able to stay for the whole session, you will receive a link so you can watch it later or even watch it again if you want. Also, your participation is completely anonymous, but we definitely encourage you to participate by asking questions or leaving comments using the chat feature in Zoom. At the end of the webinar, we'll have some time to answer these questions, and we're always happy to take any questions that you have. So with that, let's get started. Today, we're going to talk about what is medical weight loss. We'll go over some of the causes of weight gain, and then discuss the tools that are available for weight loss. And finally, we will talk about the FDA-approved medications for weight loss, as I know patients often have a lot of questions about these. So when we consider medical weight loss, what this really is when someone's weight loss efforts are guided by the support and supervision of a medical professional, usually a doctor. And this is in contrast to surgical weight loss, where someone has a surgical procedure to lose weight. With medical weight loss, we utilize a combination of diet and behavior changes or so-called lifestyle changes. And this may also include the use of medications for weight loss. Now, while I mentioned that medical weight loss is done under the supervision of a medical doctor, it can oftentimes include a whole team of healthcare professionals, including registered dietitians like my colleague Bridget, behavioral therapists, physical therapists, nurse practitioners, physician assistants. I mean, the list really goes on. And so what do I do as a medical doctor who specializes in weight management? Well, the first step is to really start to get to know my patient. And when we are treating weight in a medical weight loss program, we're looking at it as a health condition. So we try to understand the different factors that can contribute to weight in an individual patient. And this is a pretty extensive list, but by no means a complete list of some of the things that we think about. But we want to know, is there something in my patient's environment that may be affecting their weight? Or what is their nutrition or physical activity habits like? Could it be hormonal changes such as menopause that are affecting their weight? And are they taking certain medications that are contributing to weight gain? With this information and with a review of the medical history, the healthcare provider may order some diagnostic testing. This could include a test to evaluate for thyroid dysfunction as a cause for weight gain. It may also involve looking for complications related to someone's weight, like high cholesterol or diabetes. And then with all of this information in mind, that's where we can really develop a personalized treatment plan for our patients. What this typically involves are dietary, physical activity, and other lifestyle changes as a core foundational step for the weight loss process. And in some patients, we may also consider using medications for weight loss. Now, medical weight loss programs do differ in terms of what they prescribe for nutrition interventions. For example, some medical weight loss programs focus on very low carbohydrate diets or plant-based diets. So who is a candidate for a medical weight loss program? Typically, these are patients who've been unable to lose or maintain weight loss with just lifestyle changes on their own. And so they're seeking additional help and support. Perhaps they might benefit from a medical evaluation for different causes of their weight gain. They may be interested in treatment options that are being recommended by an experienced healthcare provider. And importantly, the best candidate is someone who's ready to make long-term lifestyle changes, because what research has shown us time and time again is that it's what we can stick with long-term that really affects what is going to be most successful for us in terms of losing weight. Now, I also want to acknowledge that weight loss can be very challenging. And I like to use this picture because it describes what I think many of us do experience, where we feel like we're doing all the right things to lose weight. We're decreasing our calorie intake, we're increasing our physical activity, and yet it feels like there's something that's just pushing us back in the opposite direction, almost like a tug of war. And in a way, there is. Research has shown that there are physiologic changes that occur after we lose weight, where our metabolism slows down and hormones that increase our appetite and decrease our feelings of fullness are affected. And that can make it really hard, not just to lose weight, but to maintain that weight loss long term. I also want to point out this is a simplistic drawing, so these are just some of the contributing factors. But the reason why I use this is in part because some of the weight loss medications we use actually target this part here, the hormonal changes that affect our appetite. So what are the medications that are available for weight loss? This is a list of those that are approved by the FDA in the United States. They include our GLP-1 receptor agonists. These are liraglutide or Saxenda and semaglutide or Wegovy. Naltrexone bupropion, also known as Contrave. Phentermine, which goes by a couple names, but Adipex P and Lemieux are two. Phentermine topiramate or Qsymia. Orlistat, which is Xenical by prescription or Ally over the counter, and Plenity. And you will notice these asterisks here. So phentermine is a controlled substance, so it's not prescribed by the doctors here at Form Health. And Plenity is technically prescribed as a medical device, though I have it in this list of medications. So who's a candidate for a weight loss medication? These are for patients who have tried diet and lifestyle changes already, but have been, again, unable to lose the weight or maintain that weight loss long term. And the FDA criteria includes a body mass index of 30 or higher, or 27 or higher with a weight-related medical condition. That could include things like diabetes, high cholesterol, heart disease, high blood pressure, and sleep apnea. And if you're wondering what your BMI is or body mass index is, there are a number of free online calculators where you just enter your height and weight, and it will give you that number. And how do these medications work? Well, the majority of them work by decreasing appetite and cravings. The GLP-1 receptor agonists, so Saxenda and Wegovy, also have the added effect of slowing digestion, and that can help us feel more full. Orlistat does not affect appetite, but it does block fat absorption from the diet. So effectively, you're absorbing fewer calories from the foods you're eating, assuming that that meal does contain some fat. And finally, Plenity works by taking up space in the stomach so that physically you're not able to eat as much food at a meal. There are also medications that are FDA approved for other reasons, for other medical conditions that are sometimes used for weight loss. These include other GLP-1 receptor agonists like Ozempic or Rybelsus, which are also semaglutide, or metformin, naltrexone, topiramate, and zonisamide. And importantly, when thinking about using weight loss medications, this is really done with careful consideration of your medical history and as a discussion between you and the healthcare provider, where they're not only helping you determine which could be the most effective, but also what would likely be the safest medication for you. Importantly, what we emphasize here at Form Health and what research has shown is that it's not just medication, but the combination of dietary and lifestyle changes plus medication that truly can be very effective for weight loss. But weight loss medications are not to be used in place of these diet and lifestyle changes. And this is illustrated really nicely by this study here, where they took people who were trying to lose weight and divided them into 4 different groups. One group was just taking medication by itself. One group only did intensive lifestyle counseling, and that consisted of weekly to every other week, 90-minute counseling sessions with a trained counselor. The third group included patients taking medication plus brief lifestyle counseling with their primary care doctor, consisting of about 15 to 20-minute sessions over an 8-week period, or every 8 weeks. And then finally, a medication plus intensive lifestyle counseling group. And you may be surprised to see that just medication alone was actually the least effective intervention. And lifestyle counseling without medications was more effective than just medications. However, as you can also see, when combining medications plus more intensive lifestyle counseling, we see the most amount of weight loss. And actually, let me go back here. So this is actually an older study published in 2005. And at the time, the medication that was used was a commonly used medication, but now is no longer on the market. But this has been demonstrated in other studies, including one looking at liraglutide or Saxenda. So what this is showing us is patients who are involved in the study and given a intensive behavioral therapy program to help promote weight loss, in addition to either the medication, liraglutide or Saxenda, which is this dark blue line here, or a placebo, so something that has no therapeutic effect. And what you can see here in the blue line is that people are losing weight with the combination of the medication plus the intensive behavioral therapy. And it is more weight loss than that we saw with just the placebo plus the therapy, but both do lose weight. So let's also consider what weight loss medications don't do. So they do not significantly rev up your metabolism, where now you're burning 500 more calories a day than you otherwise were. They do not replace a healthy diet and physical activity. And I think it's so important to emphasize that healthy nutrition and physical activity have benefits beyond any number on the scale. They do not address underlying life stressors that may be contributing to one's weight, and they do not work for everyone. I also think we should highlight the fact that there is the potential for weight regain after stopping this medication. So I often have a conversation with my patients where we're talking about what we call weight loss medications, but the reality is we should also think of them as weight maintenance medications. And this is illustrated very nicely by this study of semaglutide or Wegovy at 2.4 milligrams. So what you're seeing here is in the orange line, these are people taking semaglutide, and over time, they're losing weight. At this point here, at 20 weeks, they divided these patients into two groups. One group continued to take their medication, which is this dark blue line, and you can see them continue to lose weight. In the other group, they switched them to a placebo, again, something that has no therapeutic effect. And I think it's important to note that not only are they starting to gain weight, but they're not even maintaining the weight that they had lost. So effectively, what this showed is how the medication used long-term is what was most effective for weight loss. And when stopping the medication, people started to regain the weight that they had lost. So now let's switch over and talk about what we do here at Form Health. So if you become a patient at Form Health, you are paired with an expert physician who's board certified in obesity medicine and an experienced registered dietitian. And we form your healthcare team. We get to know you, understand your background, and consider all of those factors that I talked about earlier on in our talk that can contribute to weight. From there, we can develop a personalized treatment plan for you, including the foundational tools of nutrition, physical activity, and mindset shifts, and if appropriate, utilizing FDA-approved medications for weight loss. What's also unique about Form Health is that this is done entirely virtually. So you get to meet with your doctor or dietitian from the comfort of your home, just from your cell phone, using our app. Our app also has the added features of allowing you to track your weights and take pictures of foods to effectively keep a photo diary or a food log. And studies have shown that these tracking techniques are effective for helping people lose more weight. Additionally, we have a chat feature where you can send messages to your team and stay in communication. And truly, this is a level of support and accountability that is unparalleled. At Form Health, you meet with your doctor about once a month and the dietitian every 2 weeks. So with that, I'm going to turn it over to Bridget to tell us some of the questions that you have hopefully sent us while I've been speaking. And I also want to point out our website here, www.formhealth.co. In case you have other questions or want to learn more information about us, you can take a look there.
All right, everyone. My name is Bridget. I'm one of the dietitians, and thank you for those sending in questions. We're going to try to get through all of them. And so the first question was, how do I get started if I'm interested?
That's a great question. So there's a couple different ways. You can literally just go to our website, formhealth.co, and follow the links so you can sign up, or you can give this number a call. And the process that you go through when signing up is hopefully as streamlined as possible. Really, we get you set up with our coordinator who will walk you through the process of downloading the app and getting your appointment set up. And we really are just trying to help you get that care, that level of care that you're looking for, and doing it ideally as soon as we can. But we also want to make sure we get all the information about your background in terms of medical history so that we can provide that excellent level of care that we aspire to do.
Next question is, does insurance cover this program? And so what to expect with that?
Okay, so it will depend on the insurance plan, but luckily we are partnered with a number of different insurance programs. In terms of pricing, I will have to defer to the website as well as our moderator who may be able to answer some of those questions because it will vary depending on your insurance plan.
And so some questions are relating to some of the side effects with medications, whether they, heard other people that have had some side effects or they've tried them themselves and couldn't tolerate some. So, what are some of those expectations or side effects that could occur? And what are some other options if they've had some issues in the past?
Those are great questions. So it will ultimately depend on which medication we're talking about. And I will say that for each patient, there may be certain medications that you're more sensitive to, or perhaps you're on other medications that perhaps interact with a weight loss medication. So that's why one is chosen over another. I would say, some of the more common side effects that I get or that I hear from patients are with the GLP-1 receptor agonists. Those include Saxenda and Wegovy, are things like nausea, upset stomach, and acid reflux. Phentermine, which we do not prescribe here, but commonly used weight loss medication, causes things like dry mouth and can make people feel a little bit more anxious or affect their sleep. Was there a specific medication that someone was asking about?
So some of the medications were Contrave and metformin that were hard to tolerate.
Mm-hmm. Yeah, so in my experience with Contrave, I've seen patients get constipated, have headaches or dizziness, and metformin commonly causes upset stomach, bloating, and loose stools. And really, when working with an experienced doctor who's prescribing these medications, they can help sort out, is this really something related to us maybe increasing the dose of the medication too soon? Are there certain adjustments that we can make so that we minimize side effects? For example, with metformin, if you have a very high carbohydrate diet, that can sometimes worsen the side effects of the medication. There's also an extended release version that might be an option. So it's really a nuanced approach, but just because you don't tolerate one medication doesn't mean all of the medications are out.
One question was talking about other medical conditions, like if they have type 2 diabetes, are they still able to join the program?
So at this time, we do see patients who have type 2 diabetes, but I would have to clarify if we still take patients who are on insulin. I think that is one criteria where we do not see those patients, but hopefully in the future we will. But as you fill out this questionnaire when trying to sign up for the program, it'll ask specific questions about medical history. And from there, we'll direct you to, okay, you can continue to sign up, or, right now we're not the right fit for you, but hopefully in the future.
And is there any age restrictions?
We see patients who are 18 years and older.
Mm-hmm. And then, so an individual was talking about that they've tried multiple strategies in the past. So trying Ozempic and then with some dietary lifestyle changes and exercise and still not seeing the results that they're looking for. So what sets us apart with Form Health with maybe some other things that people have tried in the past?
Okay. So I think first and foremost, when we think about why someone is having trouble losing weight, that's really where it comes to the expertise of the team you're working with. So people who are going to look into your background, your medical history, try to understand, is there something else that could be going on that has been missed? Are there other medications you're taking? And it really is, a detailed conversation. We have an hour for our first appointment with patients. We can really dive into that. What is your typical day-to-day food intake, physical activity, to really assess, okay, is something what you're doing right now holding you back. But also, I think we really do appreciate that weight is very complex, and sometimes it's not just one thing or even just a combination of a few things. It's a combination of a lot of things that really makes that perfect approach for helping the person lose weight. But the bottom line is it's really that individualized discussion that we have and treatment plan. So it's hard to say what specifically we do differently, because it's going to depend on each person.
And to expand on that, even in the dietitian sessions, we'll talk and kind of look at a lot of different, factors into, weight management, and some things that we might change based on a different strategy, a different style of eating, maybe looking at, diet or exercise habits can really, enlighten maybe some little tweaks that make a big, big difference in people's plan. Because that, statement of feeling like you've tried everything and not seeing results is something that a lot of our clients struggle with. But we're seeing a lot of wonderful progress with our clients with working on them with like one-on-one and doing a treatment plan individualized to them.
And I know it sounds like a cliche, but we say this, or we think about it all the time, that weight loss is a marathon, not a sprint. And so what's great is I see patients once a month. I mean, I'd love to see them sooner, but that's kind of what my schedule is. Bridget gets the opportunity to see them every 2 weeks. But what's great about that, and why I get so excited, is that I get to see the progress in real time of what's going on with my patients. And it's not here's a medication, I'll see you, in 3 months or never. It's, let's check in, let's see how you're doing. Is this working? And we have specific time points that we're looking at. Is this patient achieving clinically significant weight loss with the interventions that we're doing in a realistic period of time? And if not, we need to go back to the drawing board. We need to consider, this patient's case and what we need to do differently to help them achieve their goals.
And I think that is it for questions today.
Okay, so since we have a little bit of time, Bridget, I'd love if you could share a little bit more about what it's like for you working with patients as a registered dietitian at Form Health.
Yeah, so some of those expectations, we have an hour for our first session. So we really do a deep dive into, your history, kind of understanding where you've come from, what your particular goals that you're working on. And then we can do a diet recall and kind of look at your eating habits, other environmental factors, and your exercise habits. And then we start pinpointing maybe some specific things that we can work on, some tweaks related to kind of the information that we know that helps with weight management. So we kind of look more for foundations of healthy eating habits and exercise, and really work with you to start with where you're at and start with baby steps and goal setting along the way to kind of get you to build upon those habits and not make it an overwhelming approach, something that's very realistic to you and your lifestyle. So we provide that education, but we also do a lot of check-ins with you from a support standpoint, that accountability aspect, and being able to answer questions in real time using the app has been extremely helpful for our clients, so they're not waiting a week, 2 weeks, or a month to get a hold of their clinicians. They have access to clinicians on a day-to-day basis. And so we will look at meal log photos. We'll give you some feedback. We'll give you tips. We'll answer those questions that you have in that real time to focus on those resolutions for you and something that's relevant for you. And so every session is different depending on the client that we have, just because it's trying to make it as individualized as possible. And so we don't do cookie cutter plans for everyone. We really want to make sure that this is individualized and something that's realistic for you, but will meet your goals and something that you can do long-term.
Absolutely. And I just want to echo, the level of support our dietitians give our patients is so fantastic. There's just so much interaction between the patients and the dietitians, and they really, consider the things that you're doing on your end. So the weight tracking and the posting of the meal photos and trying to give that personalized advice, because what reality is what works for one person is not going to necessarily work for the next. And so we really have to do this from an individual perspective of what's going to work for you. And that's what we love about our job, I think, is that we get to be creative with each person that we see. It's not the same thing over and over. All right. Are there any more questions that anyone has? Okay. All right. In case any more come in, feel free. We still have a few seconds, but in the meantime, I'll just again point out our website. If you want more information about our program, or if you want to sign up, you can go to www.formhealth.co or give us a call. And I know Bridget and I would love to meet and work with some of you in the future, and hope you enjoy the rest of your day.